Thus far, we have taken time to review the International Classification of Functioning, Disability, and Health, also known as the ICF, as well as the Diagnostic and Statistical Manual, the DSM. Both of these assessment tools are very important as we explore the mental status functioning of persons with mental illness. In what follows, I'd like to provide you with a brief overview, which will be very brief, regarding mental status evaluation. In addition to providing you with this brief overview, I want to encourage you to take the time to visit the websites that provide very clear, important information about mental status evaluations that will not only give you a knowledge base by which to understand mental status evaluations, but also it gives you a broader perspective of how to conduct a mental status examination and what information is included in an MSE report. So the first question one might have is, what exactly is a mental status examination? And this examination is a part of a clinical assessment process in psychiatric practice. And when we speak of psychiatric practice, we're talking about any treatment setting where persons with mental illness or mental disorders are treated. It might be an inpatient facility or an outpatient facility. Additionally, it is a structured way of observing and prescribing a patient's current state of mind. So in addition to providing a clinical assessment process in psychiatric practice, it also is a structured way of observing and prescribing a patient's current state of mind. There are various domains that are included in a mental status examination. Of particular importance are appearance, attitude, behavior, mood and affect, speech, thought process, thought content, perception, cognition, insight, and judgment. If you explore various definitions of mental status examinations, you'll find that there are some minor variations in the subdivisions or the domains that would be reflected. Nevertheless, what this does is provides you with a brief overview of some of the most important domains that you are most likely to observe. The purpose of a mental status examination is to obtain a comprehensive cross-sectional description of the patient's mental state, which, when combined with biographical information as well as historical information of the patient's psychiatric history, it allows the clinician to make an accurate diagnosis and formulation of relevant information needed to provide a coherent treatment plan. So when we speak of biographical information, it's understanding the history of the client. It might pertain to whether there were any mental health kinds of issues during childhood, if they were ever treated, family members, and the extent to which family members have mental illnesses as well as have been treated, because we recognize that there is some kind of biological link to various forms of mental illnesses. And from a historical context, we want to understand whether or not the person has ever been treated, and if so, what are the various forms of treatment that has been used and the extent to which it has been successful. Again, all of this information is used to obtain a valuable gestalt relevant to understanding the mental status and to formulate the most optimal treatment modality needed for the client or patient in light of their limitations. In what follows, I'll talk about some of the websites that I would like for you to take time to visit that will provide you with additional information to understand mental status exams. The first is a website that not only provide information on the various domains, but also on it provides videos, little vignettes of how best to assess or obtain that information and what the specific content would be included. So the very first website is an excellent website that provides a lot of information regarding the different domains, as well as provides a brief overview of a mental status examination and how this information is to be collected. The next website provides a PowerPoint that gives a brief overview of the mental status examination. You'll find that some of the information is redundant. However, I think what it will do is serve to highlight the importance of some of the information relevant to the mental status evaluation. And sometimes you'll see that I use mental status evaluation, examination, both of which are the same and may be used interchangeably. Next, I want to direct your attention to websites that provide forms that are sometimes used to collect relevant information on the mental status of our clients. And so I want to encourage you to look at these forms. You might find that they might be helpful to you in your future practice as licensed professional clinical counselors, because you too might be called upon as a qualified mental expert to assess the status of a person with a mental illness. And lastly, what I have here are 3 websites, all of which provides examples of sample mental status examinations. So I want you to take some time to peruse some of these examples to see what goes into a report that contains all of the relevant information about the domains and the functioning of a person with various forms of mental illness. This is it for your brief overview. I just want to re-emphasize the importance of the examination, of having a working understanding of the mental status exam. And in so doing, I want to really encourage you to take the necessary time to look over the different websites that I have for you here. You'll be glad you did. You may be called upon as a qualified mental health expert, and this information will be very invaluable as we work with persons with various forms of mental illnesses, particularly as it relates to diagnosing their limitations or their disabilities. And the other important thing about this information is this mental status examination is often used when determining whether a person should be placed in a mental health treatment facility and whether or not they would be best suited for inpatient or outpatient treatment. So again, very important. Oftentimes, we too, as licensed professional clinical counselors, are called upon to give expert information as it relates to the mental status of our clients. So it's from that perspective that I really want to encourage you to take the time to review the websites and to conceptualize and understand mental status examinations. Thank you very much.